Imagine two men in the ancient world. The first wants to have sex but cannot complete the act. The second has sex normally, yet after years of marriage, no child is born. Today, doctors would treat these as two different problems. One involves sexual function, the other involves fertility. But without microscopes, sperm tests, hormone tests, or scans, could ancient doctors tell the difference? The answer is surprisingly complicated. Some of them understood that a man could fail at different stages of reproduction. He might lack sexual desire. He might be unable to have intercourse. He might fail to release semen, or he might release semen that did not produce a child. They could see that these were not always the same problem. What they could not do was reliably tell which one was happening. The clearest early evidence comes from ancient Greek medicine. One Hippocratic text describes a group of Scythian men who supposedly lost sexual desire and became unable to have intercourse after spending much of their lives riding horses. The explanation was wrong, but the writer was clearly describing a problem with sexual performance, not simply a failure to produce children. Elsewhere in the Hippocratic writings, male reproductive failure is described differently. One passage suggests that a man may fail to produce a child because semen is not pushed out properly, cannot pass through the body, or has been damaged by excessive heat or cold. That is not the same as saying the man cannot have sex. The sexual act might happen, but something involving the semen could still fail. Aristotle made the point even more directly. When a man and woman repeatedly failed to produce a child, he wrote that the cause might lie in the man, the woman, or both of them together. So, at least some ancient thinkers understood something. Many families still resisted, accepting the woman was not always responsible. That raised a much harder question. How could anyone prove the man was infertile? A man who could not have intercourse had an obvious problem. The failure could be seen. Infertility was different. A man could have normal desire, achieve an erection, release semen, and still never cause a pregnancy. To ancient observers, everything might appear to be working. They could examine the genitals. They could ask whether the man felt desire, whether he could have intercourse, and whether semen came out. They could also look at the semen itself. Was there enough of it? Was it thick or watery? What color was it? Did it come out with force or only in small amounts? Later physicians working in the Greek medical tradition wrote about semen that was too thin, too thick, strangely colored, produced in small quantities, or unable to leave the body normally. They also connected reproductive failure with age, obesity, genital injuries, blocked passages, disease, and castration. This was a real attempt to separate sexual performance from the ability to produce healthy semen. The problem was that appearance could only tell them so much. They could not see sperm cells. They did not know that semen could look normal while containing very few sperm, or none at all. They could not measure movement, shape, concentration, hormones, or damage inside the cells. The biological roles of the testes in sperm production and male hormones would not be properly understood until much later. So ancient doctors often relied on ideas about heat, cold, moisture, bodily balance, and masculine strength. A strong man with a powerful sex drive might be assumed to be fertile. A man with little desire or difficulty maintaining an erection might be assumed to have weak semen as well. Sometimes those problems did occur together. Sometimes they did not. That was the line ancient medicine could see but could not measure. And because male infertility was so difficult to prove, the woman was still usually examined first. Greek medical texts devoted enormous attention to the female body: menstruation, the womb, vaginal treatments, fumigation, diet, and medicines intended to improve conception. Male reproductive failure was acknowledged, but it rarely received the same detailed program of examination and treatment. That imbalance had consequences. If a husband could have sex, people might take that as evidence that he was capable of fathering a child. If no pregnancy followed, suspicion returned to the wife. Her womb was blamed. Her menstrual cycle was blamed. Her diet, body shape, behavior, or relationship with the gods might be blamed. The man's body could remain almost completely unexamined. In other words, ancient people sometimes understood the difference in theory better than they handled it in real life. They knew that being unable to have intercourse was not automatically the same as being unable to produce a child. They also knew that a man could contribute to infertility. What they lacked was a reliable way to test the invisible part. Impotence could reveal itself during the sexual act. Infertility often revealed itself only through the absence of a child, and that absence did not tell anyone whose body was responsible. So did ancient people know the two conditions were different? Some did. They recognized problems with desire, erection, ejaculation, semen, and conception as separate possibilities, but without the ability to examine sperm, the distinction remained uncertain. They could observe what a man's body appeared to do. They could not see whether the tiny cells inside his semen were capable of creating life. And that gap between what could be seen and what could be proven left many infertile men undiagnosed and many women carrying the blame.